Good morning, guys. I hope we're all sparkly. It's Friday, it's my day off, and I'm at work. Why am I at work? I've got to do my appraisal to make sure that the regulatory bodies think I'm safe. I am safe and effective, hopefully. 5,000 plus patients. Anyway, so it is what it is. Nobody cares. Work harder. Life can be a challenging endeavour. And if you can meet triumph and disaster and treat those two imposters, Tyler's just hanging his head now. I say that all the time, but it is. Life is a challenging endeavour. I've been invited to speak on International Men's Health Day to the emergency services, more accurately to the London Fire Brigade. And I'm honoured. Thank you very much for inviting me. And we're going to talk about how life is not fair. It's mental health. Life is not fair. How depressing. No. Nobody cares. Work harder. Now, these guys, they go towards danger, not away from it. They see people at their worst. They're most irrational. So do I, with high estrogen. When you've got low testosterone, you're just miserable. But when you've got high estrogen, you're uncomfortable with all these emotions. I've got a 2-2 guy who spiked his E2 and he didn't like it. Having all these emotions. So we've had to dial it down and get him optimized because it's all about ratios. It's all about balance, which necessitates contrast for equilibrium. Yin yang, baby. Yin yang. So yeah, these guys run towards danger, not away from it. And your instincts should be to run away from it. So it's fight or flight. But flight is far more effective if there's the potential threat of actual danger, real physical danger. Danger to life. Now, we've spoken about the polyvagal theory before. This is a wonderfully interesting topic because we are animals, but we have consciousness that clouds our perspective. Consciousness should aid us. It should be a playground, but we still have these primal desires and drives that feed us to be effective adults because physiology impacts psychology, psychology impacts physiology, but you can't be healthy without physiology. You can't outthink your physiology. So let your behaviors impact your emotions. Don't let your emotions blunt your adventures. So yeah, running towards danger, the polyvagal theory. What's it all about? Well, you've got two arms of your autonomic nervous system. This is an innate nervous system, so not under your control, but that's not quite true actually. So you've got your sympathetic fight flight, which is constantly responding to danger or potential danger. And are we seeing potential danger everywhere? Yeah, listen, I catastrophize everything. I went to lunch with Lydia yesterday and I choose where we sit. I choose where we sit so I can make sure I spot the dodgy people. I can know where the exits are. I am aware of my surroundings for potential danger. There's no danger, but I'm always aware. I'm considered. Why? Because I'm balanced on testosterone replacement therapy and I'm an evolved human being. But it is a challenging endeavor. So when we talk about fight or flight, yep, we don't have to fight or flight really in this world. We're safe and an animal is surviving. We've survived. So we're in this wonderful playground. And what do we do with it? We create artificial anxieties. We subject ourselves to psychological stress, but we're physical beings. So yeah, the other side of the autonomic nervous system is the parasympathetic nervous system. This is the calm state, the relaxation state. You have to have contrast. So when you're in a parasympathetic state, are you also in a sympathetic state? Yes, of course. Yin yang, baby, because you have to have the capacity to respond to danger. So it makes sense. Much like when you're in the sympathetic state, you have the capacity to respond appropriately to that stressor. You don't want to release all of your energy when it's not appropriate. So you have to manipulate your sympathetic nervous system with your parasympathetic nervous system. And how do you do that? Because it's innate. It's not under our control. Well, it is. Yes. So we've spoken about this before. You do it via what? Breath. Whenever I'm anxious, I ask myself, how is my breathing? And I know my breathing is not slow and considered. So I have a little laugh to myself. All that worry. Okay, bring me back to what? Bring me back to the moment, because the moment's all that matters. So how else do people find comfort? Yeah, these chunky monkeys, they comfort eat. And lots of us are emotional eaters because eating brings us comfort. So what's your primary drive when you wake up? Well, it should be to go find food because you're a hunter. So yeah, you will switch from a predominantly sympathetic nervous system to a parasympathetic nervous system, and that initiation is food. So yeah, fascinating, very simple. And then underneath all that, you've got obviously your hormones, and hormones form the base. There's a chronicity to hormones. The textbook answer to what is a hormone: it's a chemical messenger that helps facilitate the function of its target organ. But it's far more complicated than that, isn't it? You're recovering from the day to prepare for the next day. But we know that hormones impact mood, and mood impacts behaviors. So you've got your sympathetic system, your parasympathetic system. And if you're faced with a massive flight stressor, what's going to happen? You're overloaded. Now that can be an acute thing, or it could be a chronic thing over years, overloaded, and you haven't got that balance right. So what's going to happen? You're going to shut down. You're going to shut down, and you're going to go into the dorsal part of the vagus nerve. And that is, everything shuts down. You preserve your vital organs, but your consciousness will switch. It'll dull. And if you think about a lion in the grips of, a gazelle in the grips of a lion's mouth, and it goes limp, it's facing certain death, but it's still alive. So what is it doing? It's protecting itself. Why? Because there's the potential to escape. So again, if the lion releases the gazelle and the cubs get distracted, the gazelle can run away. You often see the shake off when the gazelle wakes up and goes, right, let's shake off. It's shaking off its sympathetic nervous system. It's fascinating, isn't it? So we deliberately put ourselves in the path of danger, and the emergency services do that voluntarily. But it's going to have an effect. It's going to wear you down, because it must wear you down, because you can't cheat physiology, your psychology, your resilience, your fortitude. You trained all of your life to be a fireman. You trained all of your life to be in the military and faced all of these awful situations that you're facing. You should be able to cope, but eventually it will wear you down. And so you have to be 100% considerate about everything else. Now, we talk about looking at stress reduction. Again, you can do that through training. You can do that by implementing positive behaviors in your lifestyle. You've probably done the naughty things: gambling, drugs, alcohol, to name a few. Not personally, well, no. But again, what we should be doing is looking to the calming part of the nervous system. And lots of these firemen and military guys, they do fizz, because they get that comfort. They get that reward from the exercise. They get the endorphins that they're wanting. But it's not just about that. It's not just about fizz. And we see so many military guys, and they are literally just burnt out because they've tried to out-exercise their low mood that's come about as a result of this distorted, weird world that we live in. So again, working on breath, working on the calming part of the nervous system, whether it be grounding, just walking on the grass with no shoes on, having a moment, just leaving that bloody phone away, put it away. So many people in the gym are on their phone. It's ridiculous. My phone is there for music and music only. I do not look at my phone. I'm only resting till I can go again. I don't want distraction. I'm here for a purpose. I'm here to train hard. And then I leave. But I see so many people on their phone. Oh, I'm resting for 30 seconds because the day, just get on with it. Stop messing around. So again, what we're thinking about, it should be the moment. You should be 100% engaged in the moment. And we're often not 100% engaged in the moment. And you can't outthink your physiology. So if you work towards optimizing your stress, your sleep, your nutrition, your exercise, but again, military, not overdoing that, understanding yin yang and mindset. And again, I cannot be beaten. You can be beaten, and you will be beaten, because it is about this, 100% about this. And the testosterone deficiency is often the end result of a cascade of wrongdoings. And you go on testosterone and you go, here I am, let's go. Well, it can be that if you've got all your ducks in line. So you've understood the concept of balance. You've understood the concept that you are a mortal human being. And if you're looking at everything proportionally and considered, which you're not because you've got low testosterone and you want to get better, you desperately want to get better, that's my role. Listen, I can dial you in easy, but you have to trust the process. You have to trust us, not your emotions, because your emotions are there to keep you safe. But we need to change. We need to keep taking that next step forwards. And the only way you can do that is by taking that next step forwards. But we're comfortable in our little purgatory. No, you're not, are you? And it's about being the best version of yourself. So you have to not only trust the medicine, you have to trust us, that we'll always act in your best interests. It would be nonsensical for me not to act in your best interests. So when I say something, I've done this thousands of times. And the guys that we struggle with are guys that have what? High estrogen. But it is what it is. Yes, no worry. And when you apologise 4 months later, it's not a big deal. We've done this thousands of times. But again, we all have to work on our mental health, don't we? All of us. Are you happy? Marcus Aurelius. The happiness of your life depends on the quality of your thoughts. The quality of your thoughts is dependent on your behaviours, on taking that next step forwards to do what? To go earn your reward.